We live in a deeply broken, not just health system, but political system in the US, where health is a privilege and a commodity. We see huge disparities by race and ethnicity, by income level and immigration status. While we have great wealth in the system, it is deeply inequitably distributed. We work alongside health departments, community organizations, community health worker associations to help accompany them in building programs and policies and new collaborations that advance health equity at a local level. We then work to bring that set of local work together into national advocacy and movement building work that will continue to put pressure on our policies and systems to ensure that everyone can exercise that right to health no matter where they are in the United States.
In Immokalee, there is a chronic lack of access to social services, particularly healthcare. And on top of that, 50% of people here are migrant. Our goal is to find ways to bring available services closer to our vulnerable communities. Teaming up with diverse partners, we were able to put together a very robust response centered around community health workers. They know better than us about the real issues the community is dealing with and how to best address them. So we hope to push further to expand that infrastructure throughout the region and essentially integrate it in the health system for the long run.
New Bedford is a diverse community. It's a community that's been fighting for its way for a long time. We recognize that those communities that were being hardest hit through COVID, we had the fewest amount of resources, and so we had to really build that capacity, which we did with the help and support of Partners in Health. And as a result, we've added a number of community health workers or community outreach workers to really work closely with those populations that have been marginalized. It's important for the health department to connect with grassroots organizations because they're at the core. That's why we engage with community partners, and that's why we make sure that we have cultural competency in the work that we do.
Parte del Departamento de Salud no es específicamente de una clínica ni privada ni pública. Eso es lo que yo les digo.
This work is a glimpse into the future. We are strongest when everyone is able to pitch in and be a part of the solution. We really want to seek that innate power that's in every community.
We need to both work with communities to demand our right to health and health access, but we also need to work with government partners as those responsible for delivering on that right. So we work with elected officials and other policymakers to help inform them about critical issues we care about and offer them our expertise and resources. We also do organizing work, so we go and do Hill Days and bring folks together at a state level in DC to bring perspectives to policymakers from around the country. We know that it's essential that we improve service delivery for communities today. There's a lot of acute needs, there's a lot of suffering that we want to be part of addressing as Partners in Health in the United States. But so much of that present day suffering and inequity is really driven by these upstream policies and systems that are holding those unjust conditions in place. Health equity is not work that one organization or one institution or one individual leader can drive change alone. It's a challenging time here in the US right now, but we feel like it's more important now than ever to be committed to this work. Demanding rights and organizing for a better future for this country is long-term work, and we have to keep at it.